Hey guys, Julie here from the Clayman Thyroid Center. I'm joined here with Carlyn today, and she's going to be talking to us about her battle with thyroid cancer and how she has been able to overcome that. We're doing this for National Cancer Survivors Day. So, our first question here is Carlyn, please tell us a little bit about yourself, your basic background, where you're from, what you do.
Hello, my name is Carlyn Ray, and I am a glass artist. I have a glass blowing studio in the Design District in Dallas, and we specialize in creating custom art for individuals to share the beauty, color, light that inevitably come with molten glass. I'm passionate about it. I saw it when I was 8 years old. I fell in love with glass. It's changed my life. It's a joy for me to share. And my studio has been really my path, purpose, and passion since I was 8 years old. So what we do is really create custom art, kind of like this piece behind me. And it's really been a driving force, working for Dale Chihuly in Seattle, traveling around on cruise ships, blowing glass. It's really led me into an amazing, magical journey. And I've been really focused on glass blowing. And my journey now with thyroid cancer has opened up a lot in how I now create and how I work with the material, with my clients, and really live my life. So it too has been a journey in and of itself, and I'm excited to share that with you because it's been very meaningful to me.
Mm-hmm.
What I have learned is when I was first diagnosed and even kind of knew a little bit more about thyroid, it was in 2020. And I learned I had Hashimoto's, which is an autoimmune disease. Hashimoto's makes you really tired. It's almost like when you have really bad allergies, and it's a struggle to get through the day. I slept a lot, I was tired. I did drink a lot of caffeine to keep me going through the day.
Mm-hmm.
I love what I do, but it was a little bit of a struggle. And I had the brain fog. I just wasn't myself. And I worked on my diet. I worked taking supplements, and I really thought I could overcome this feeling. And it was just a struggle. I wasn't myself. I wasn't enjoying my life and my work and creating as much as I used to.
Mm-hmm.
And I started learning more about my thyroid. I didn't know what to do. I felt lost. I'm very much a natural, I like to take the natural path. So I was taking supplements, and I was on Tirosint, a thyroid medicine to help me. It did help quite a bit. I was at an energy level down here with Hashimoto's, and I felt much better after I started taking it, but I still wasn't the same. And then all of a sudden I'm on the family Zoom call during the pandemic, and my sister notices a big bulge right here. And she says, "Carlyn, what is that? I think you need to have it checked out." And so that was the start of my Hashimoto's. I then received ultrasounds, and they said, "You need to probably check back with us." I received another ultrasound, and they said, with your family history of my half-sister having thyroid cancer, we really think you should get a biopsy. And this was just a few months ago. And so I received a biopsy, and that biopsy came back and said, there's a 50-50 chance you have cancer. And I didn't know what to do with that. And I was scared. I had fear that if I was to go to just a surgeon here, that they would just take it all out, take out my whole thyroid. And a thyroid regulates a lot. A thyroid is a very important organ for your emotions and how tired you are. And I had just a lot of emotions in my stomach around that, and I did not want just to take it out because there's a 50% chance that I don't have cancer. And so I was really lost as to what to do and what the best next step was. And I was working with my physician more than my endocrinologist. My physician offers me natural routes, kind of a middle road, and then kind of a more pharmaceutical road. And she knew that I didn't want to take the drastic route of just taking it all out. She said some people, when they find out they have cancer, they just want to take it all out. And I said, I don't, because there's a 50% chance that I'm healthy. And so she went on the internet and she found the Clayman Thyroid Center. And this is an amazing center that people go to from all over the world. And it really speaks volumes that this is all that they do is work on thyroid cancer. And they will do surgeries after other ones have gone badly, poorly, which really shows their expertise and their passion. And she said, that really speaks volumes. I really trust them. I think you should give them a call. And they would be top on my list if I were you. I trust my physician. She understands me. And that's what I did. I called the thyroid center, Clayman Thyroid Center, and within days, Dr. Roy calls me back. And her demeanor, the way she explained things, the way she said, really, you really don't have a choice. When you have this biopsy reading, the next step really is to remove it. I was like, can I just take a node? Can I just take a little bit of it? Can you take just a sliver of it just to see if there's cancer in there? And she said, we can't. But what we can do is we can take half of it. And we can test for cancer in the operating room. And if it's bad, then we can take all of it. And if it isn't, then we can stitch you back up and you're fine. And you have half of it. And that really made me feel supported and good, because I had a lot of fear that if I just went to a general surgeon, they would take all of it. And this way I can keep half of it, and a good half of the thyroid can really regulate a lot. And if both of them have cancer, I don't want both of them. So it really is the best of both worlds. So I talked to Dr. Roy, and then I said, she's my surgeon. I want to research about this before I make my final decision. And I researched about Dr. Roy, and I found that she is passionate and one of the top thyroid surgeons in the world. Her passion shows in her studies. She went to Johns Hopkins. We went to Columbia. She led the thyroid. She was head of thyroid surgery back in 2011 for Princeton. And she chose that as her passion. I think she has done more thyroid surgeries than any surgeon. And her manner, her demeanor, the confidence I felt when she was speaking to me made me feel supported and listened to and heard, and I knew I was in really good hands. And then I further understood that she was going to be in the operating room with the top surgeon, Dr. Clayman, who's been working and doing thyroid surgeries, I think, for over 23 years. He was head of the University of Texas, the MD Anderson program. He was head of the thyroid surgery there. And just like Dr. Roy, he chose just to focus on thyroid cancer and surgery. So between two of those, I think they're the best. I was in the best hands of anyone. I had both of them in there working on me. And I felt like that was absolutely hands down the right decision.
Mhm.
And personally, in my personal life, I am growing my studio. We were expanding. So this was a perfect time at that moment for me to have surgery, because for 3 weeks after your surgery, you're not able to pick up more than 3 pounds. Well, being a glass artist, blowing glass, doing installations, fabrication, it's a big part of my daily life. It was really important for me. So I was like, I want to have this happen right away. I am ready.
Mhm.
After talking to Dr. Roy, I am ready. And within about a week and a half, they said, all right, on Wednesday, you're in. I booked my flights. I'm blessed. My sister lives in Clearwater, Florida, so I was very close. But they said, before they knew that, they said, we can recommend hospital or hotels. And they had everything kind of all set up. So if you don't have a family member in the Florida area, they absolutely have everything you need to know as to where to stay and how to get there. So I decided to have the consultation be the morning of my surgery, because I'm flying in, really trying to expedite this whole process.
Mhm.
And so I had to talk with a couple of people about my insurance and just getting kind of some ducks in a row. That was my first surgery, so I'm not really sure. I didn't know what to expect with the surgery. So insurance documents, and they were really good about telling me what to buy beforehand. So ibuprofen and Tums and vitamin C, just some different things to make sure that you're set up with. So I showed up there very early in the morning, and I drive up, and it's the most beautiful facility that you could imagine. Brand new, clean. It's just for thyroid. I just felt like this, I feel right. And I think that's really important, because everyone has a lot of anxiety and stress leading up to a surgery. And I think that was mitigated to the smallest level because I was in the best hands. And look at this facility. This is really top of the line, the best facility that I could have put myself in. And so from the moment we sat down, there was breakfast available for my sister, and I checked in, and they led me, did a little paperwork, and they led me down the long hallway, and the nicest people. And the first thing they did was they checked me into a room, and one really important, there's a couple really important things that made me want to go to the best too, is you want to keep your parathyroids, and you don't want to nick your vocal cords. And going to someone who just does this type of surgery over and over again made me feel confident that there was not going to be a problem in losing my parathyroid or my vocal cord. So the first test they did was they actually go up your nose and down your throat. They find and they locate those little vocal cords, and they mark exactly where they are. And they do ultrasounds, and they find your lymph nodes, and they locate everything inside of you. They make a lot of these documents so they know exactly what to expect before they open you up. Very thorough and very, very nice people. Everyone was chipper and happy and accommodating and just sweet. You know, I think also working in such a beautiful facility, there's just such a great energy about the place. And so from that room, then they wheel me to these different rooms, and you're in the bed and you're in the gown now. And we waited in the pre-surgery area, and I met all the nurses, and they sat down and talked to me. How did I feel about everything? Did I have any questions? And then I met the anesthesiologist. I was working with 2 of them, and just the sweetest. Sit down and talk a little bit and explain everything. Dr. Roy came up several times before the surgery, asked if I had any questions. And I still was, I said, Dr. Roy, are you sure this is what I have to do? I still want to keep it. I still don't want to take out half of it. And she sat down and she went through the whole thing with me again, as to why this was important.
Mm-hmm.
She said there's a 50% chance, yes, that you're absolutely healthy. And, but this is, if I didn't do this surgery, I would have to check every 3 months or every so often. They would have to check it. They would have to do biopsies after biopsies after biopsies to continue to keep an eye on it. And that sounded really stressful.
Mm-hmm.
And I said, all right, okay, so this is the right decision. Okay, I'm trusting you. This is what you think is best. Thank you for listening. I'm ready.
Mm-hmm.
And so they take me into this room, and they explain to my sister, they explain to me how long it's going to take. It's a fairly short procedure, but the prep work and just getting everything settled took a little bit longer. And I went under, and then, I went in this room, and all of a sudden I wake up, and I didn't feel anything. There were some bright lights. I remember there was a lady next to me and a lady over here, and there was a nurse right next to me. And she was just like, how are you? How are you feeling? Just so sweet. Can I get you anything? And I felt fine. I was kind of shocked. I'm like, well, that was it. Like, it was just, I just woke up and that was it. And she made sure I was okay. And then they wheeled me into my recovery room. And Dr. Roy came in and she said, you had cancer. And I was shocked.
Mm-hmm.
I kind of knew I didn't have cancer. And she said, you had cancer and we removed it and you're fine. And I was shocked and happy. I knew I made the right decision.
Mm-hmm.
It's just so many emotions just flooded me when she said that. She said, they told me before they had to take out my lymph nodes.
Mm-hmm.
Your lymph nodes don't serve you if you don't have your thyroid. So I was fine with that.
Mm-hmm.
So they took out, and that's where the little cells of cancer were. And my thyroid she said my thyroid was really inflamed. It was really bad. And I said, out of 10, how bad? She said, it was a 7. And it was sending your body a lot of antibodies that you were having to fight. And she said, it was the right decision to take that out. You're going to be healthier and your body's going to be happier now without that. And she said, there were little cells and the other side is just fine. So we left the other side in, but we took out the bad side. And she said, you made the right decision. And I'm so happy I did it right away. And that was the right decision of not waiting, not prolonging, and doing that right away.
Mm-hmm.
And so the nurses made sure I was okay, and I went home that day. I went home immediately. They gave me a popsicle after I got out of the surgery, and I was in the recovery room, and that was really nice, and some juice. I love apple juice, so they had juices available for me. And they took really good care of me, and they wheeled me out in a wheelchair and helped me into the car, and then I was able to recover at my sister's in her bed over the next few days before I flew home. They originally said I could fly home, I think 2 days after surgery, but I really struggled after the surgery. I was really tired. As I say, I take kind of the more natural route. I think the drug that you take to sedate you, I think it's in my system, and I was just really tired. My body was hit hard. It was recovering. I do listen to my body, and I slept. I slept for 3 days. I had surgery on Wednesday, and I booked my flight for Sunday, and that was really good timing for me personally.
Mm-hmm.
I was able to, they suggest you walk around to get the blood moving. That helps the drugs get out of your system. I iced a lot, so I'm a month after. So you can see how this scar looks. Now, the width of this scar was a surprise to me.
Mm-hmm.
I guess I didn't research that part. So after the surgery, when I looked into the mirror, I was shocked.
Mm-hmm.
She assured me, I've seen people now, it's just a tiny, tiny line after it heals. So right now it still has the silicone bandage on it, which is what they give. So I'm a month after. It still has the silicone bandage.
Mm-hmm.
I have my scar away, which is what you put on it to recover, to help the scar heal. It doesn't hurt at all. My neck was puffy afterwards.
Mm-hmm.
Another thing that I found remarkable is when I left the hospital, the nurse and Dr. Roy said, here are all of the nurses' cell phones. Dr. Clayman also came in afterwards and talked to me about the surgery. This is Dr. Clayman's cell phone. This is Dr. Roy's cell phone. Call, text at any time. And talk about feeling supported.
Mm-hmm.
Knowing that if I had any question, they would answer. If I was unsure about anything, they were all there.
Mm-hmm.
It was really a remarkable feeling and such a testament to how much they care.
Mm-hmm.
And they call, they said the nurses call you tomorrow. Of course, I was sleeping because I was just exhausted. But they said, if you need anything, let us know. They were attentive. They were making sure that I felt supported and informed. And it was remarkable.
Mm-hmm.
Soft foods. That's really what, your throat's a little sore. I was not aware that I would have so much congestion, which is a little scary because you're not wanting to cough. And after surgery and something being stuck down your throat, I think you have a lot of congestion. So they do say to do Mucinex. I did the extra strength, which I'm really glad about. Oh, I did a low dosage so I could take 2 of it, which equal an extra strength.
Mm-hmm.
And I was very on top of that because the congestion going down your throat is not comforting when you can't breathe and you're already really sensitive and you don't want to move really, you don't want to cough, you don't want to work these neck muscles. So that was alarming and a little scary until that kind of calmed down. So the Mucinex was a big deal for me. Drinking out of straws, making sure you have straws available was a big help. So you don't have to tilt your water back. Having soft foods and healthy foods available. You just go through a surgery, you want to treat your body with love and care and good foods. So soups. I wish I had applesauce available. I did do a lot of the fruit popsicles were really helpful. And just liquids and kind of mushy foods for a while is really nice. And they're going to tell you you're going to keep your head elevated, so a lot of pillows. They're really good about giving you the heads up of what to expect. But my personal experience was to treat yourself with love and care. To be careful when you're washing your hair, to not let your head go back. You're going to have to wash your hair this way. I think just prepping your home too, know that you're not going to be able to lift more than 3 pounds. So kind of think about what in your daily life do you need to maybe adjust to where you can do everything that you need to do. Ask for help. And that was a big thing. On the flight home, if you're flying in, this was a big deal. I would have, now in hindsight, called the airlines and said, I just had surgery. What can you do to help? So I think I can allow you to go in a wheelchair through the checkout line, not carrying a heavy luggage, wheeling it because you don't want to strain yourself. So I allowed a lot of people, they let me pre-board. They helped me I was the last person off the plane when I landed, so no one's rushing me. So taking those things into consideration and taking help where it's available. So I think that's a really big deal, is to plan ahead and let those airlines know that you just had surgery and you would like any help that's available and offered to people in your condition. Then coming home, I was tired for a while. I read a lot that people are up and ready for work and they're fine. So I kind of scheduled a couple of meetings, and they wore me out. So, just make sure that, know that you could go anyway. A lot of people are just fine after the surgery, but I was tired. It took me a while to kind of pop back. And, I wear scarves. So during meetings, just having a little scarf and just kind of doing a little tie or something allows, you to be fine without anyone seeing your scar if you're kind of conscious about it. So there's a lot of ways, in the wintertime, obviously, turtlenecks are great, but there's a lot of cute things you can do with the scarf. My business partner said, I'm going to set a new fashion trend with the glass bars to be wearing scarves when they're working. So there isn't anything that I would have done differently. I'm really happy I did it early. I'm thrilled that I chose to go to Dr. Clayman in the Thyroid Center. It absolutely, hands down, the best decision I could have made. And Dr. Roy said my surgery was a little tricky. I have a long neck. When you grow as a baby, your thyroid drops out, and sometimes it hangs on up here. So my lymph nodes were way up here. So they had, they go through this little cut, and they had to go all the way up to here. And then I had my 2 parathyroids, and one of them was in a precarious position, and so they reattached it to muscle so they could save it and it could get blood supply. So it was not just a regular thyroid surgery. There were little complications that made it difficult, where I was like, I'm so happy that both of you all were in there. I was in the best hands, and it was 100% successful. So, now that I have my cancer out, it makes me reflect on how did this happen? So Hashimoto's, I researched Hashimoto's. You get Hashimoto's by having 3 things, all 3. 1 is genetics, 2 is environment, like mold, black mold or something, and 3 is stress and anxiety. And I didn't register that I was stressed. I love my work. I love creating. I love my team. I love my clients. I love what I do, but we're opening up a new studio. I'm hustling. I put up my heart, my soul, my everything into my work and my business, and I wasn't balancing myself and doing the self-love and care that I needed to do, and recognizing my feelings. And this opened up, and is a way that my body said, hey, I need a little of your attention and acknowledgement. This is my way of saying something's not right, something's off balance. And so since this opened my eyes to that, I have been meditating. I've been going to a therapist to help me understand how to deal with stress and anxiety, how to be more comfortable in my feelings, how not to mask things. And all of this has really taught me to live my life forward, to live my life in harmony, listening to myself. I am now a better person. I am now a better artist. I'm a better leader for my team, and I'm happier. So this was a gift to, I feel like I'm almost born again. I feel like I have a second chance. I feel like this has taught me to live my life fully and gracefully and trusting and in love. And I'm so grateful for the Clayman Thyroid Institute for giving me that second chance.
Mm-hmm. Mm-hmm.
Thank you.
Well, Carlyn, thank you so much for sharing your story. You are incredibly inspiring, and I think your outlook on this situation, the card that you were dealt, is really incredible. And I really hope that we can, reach as many patients as possible who are suffering with a similar diagnosis and kind of, give them comfort with your story.
Thank you.